welcome back to top tier info on whatever. In today's video, I'll just be speaking on the different types of diseases affecting cattle in Jamaica. And there are various diseases in various categories. The first one I'll be starting off with is a tick-borne disease. But before that, I'm just gonna tell you like all of the other diseases. So you have the foot and mouth diseases, you have the bovine respiratory diseases, like example pneumonia, you have the bovine viral diarrhea, you have brucellosis, you have mastitis, and you have bovine papillomatosis. So let's get into this video. So tick-borne diseases. Examples of tick-borne diseases are anaplasmosis and babesiosis. The causes of anaplasmosis and babesiosis are caused by bacteria and parasites transmitted through the bites of infected ticks. So remember that ticks and like external parasites like ticks and fleas, they're actually vectors and they sometimes carry diseases. So anaplasmosis and babesiosis are caused by those like vector type of ticks. So the symptoms involves fever, loss of appetite, weakness, anemia, jaundice, and jaundice is like when the animal eyes they're like yellow, jaundice, and sometimes death. The treatment for tick-borne diseases involve antibiotics and antiparasitic medications along with supportive care such as blood transfusions for several cases. But in most cases, like when an animal has ticks, like it does administer antibiotics and then use like a tick pour-on, like a tick killing pour-on to just spray the animal to just kill those ticks. Next one is the foot and mouth disease. And causes of foot and mouth disease is the bacteria, in particular diffuser bacteria, Microforum, which thrive in wet and muddy conditions. Symptoms of foot and mouth disease involves fever, blisters, or sores in the mouth. You have sores on the tongue, sores on the feet, sores on the teeth, and the teeth are like the nipples on the udder. The udder is like the cow's breast, and like the teeth are like the nipples on the breast. And you got lameness, you see the animal drooling, and you see like a devastating decrease in the milk production, and this is as a result of stress, because when the animal is under adverse stress such as a disease like this, then it will cause a drastic decrease in their milk production as well. The treatment, there's no specific treatment for foot and mouth disease. Normally affected animals, either you quarantine them, or if it's too bad, you cull them, because this disease it's one that's very contagious. So normally if it's bad to the point where you're trying to control it and it's not getting better, then like the best thing to do is to cull the animal just to prevent it from just spreading. But vaccination is a preventative measure. So if you give the animal the vaccine beforehand, then it will help them, if they even get it, to just overcome it more easily. And you can see the photo of this animal here. You can see that the things on the foot, just look at this animal, like this have to be like one of the most devastating diseases, because it causes blisters, and those blisters, can you imagine like when you get a cut on your skin, or even a blister or a bump or a sore, how hurtful that is, that the animal's skin is sensitive as well, so they can feel it, so it's hurtful, it's painful to them. The next that we have on this list is the bovine respiratory diseases, for example pneumonia. So the causes of bovine respiratory diseases is a complex respiratory infection caused by a combination of viral and bacterial pathogens, often exacerbated by stress factors such as transportation or overcrowding. Symptoms include coughing, nasal discharge, fever, difficulty breathing, the loss of appetite, and lethargy. Treatments involve antibiotics, anti-inflammatory medications, and supportive care such as providing warmth and adequate nutrition. Next, we have the bovine viral diarrhea. Causes of BVD is the diarrhea virus, which belongs to the pestivirus genus within the Flaviviridae family. The virus can infect cattle of all ages, and its effects can vary from mild to severe, depending on factors such as the animal's age, the immune status, and the strain of the virus. Symptoms of this are fever, diarrhea, respiratory signs, decreased milk production, reproductive issues, example abortion and infertility, and mucosal discharge in severe cases. The treatments, supportive care to manage symptoms, vaccinations, and biosecurity measures to prevent spread. Now, if you look at this cough, right here, you can see, like, look how the coating of the skin, it is ruffled. From you look at an animal like this, you know that something is definitely wrong. If you look at the eyes, look, they don't really look right. Like unhealthy animal eyes would be bright, but this animal, which is unhealthy, like you can look at the coat and see how it's ruffled. You can look at the eyes and you just, the animal's posture, you can just tell a lot about this animal, that this animal is not in a good physical health. Like, these are signs that you can look out for. And I'm gonna do a video on that, just showing you signs of unhealthy animals that you can just see through observations. Next, we have the brucellosis. So causes in cattle is primarily the bacterium Brucella abortus. This bacterium can infect other animals, including humans. So this disease is actually zoonotic disease. Zoonotic disease is a disease that can spread from animals to humans or from humans to animals. So it's vice versa. And these diseases are very contagious. So you have to be careful when you're treating animals with these diseases, as to prevent, like, the caretaker from actually catching that disease. So the symptoms involve reproductive issues like abortion and infertility, joint inflammation, and fever. Treatment: there's no cure, but affected animals are usually culled to prevent spread. Vaccination and biosecurity measures are crucial for prevention, because again, this is a very contagious disease that can spread from the animals to the humans, to the caretakers, or from the caretakers to the animals. So you have to be very careful when you're dealing with these cases. Next on the list is mastitis. Mastitis is basically inflammation of the mammary gland. So usually this is caused by bacteria, often entering through the teat canal. And cases of these occur like when the animals are milked and then there's not proper post-milk procedures. So normally when you milk a cow, normally you would dip those teats in iodine as to prevent bacteria from entering. So when these things, if the milk is not milked out properly out of these teats as well, this can cause mastitis. And mastitis can be caused by various things. So, but the primary thing that causes it is the bacteria. So the symptoms include the inflammation of the udder, swelling, heat, redness, abnormal milk, you see clots, you see discoloration, and in more severe cases like the milk, like an animal with mastitis, when you milk that animal, the milk would have a very bad odor. Like the milk would have a very bad odor in serious cases. Treatments of mastitis, you have antibiotics, you have the today and you have the tomorrow antibiotics they normally use. You have the anti-inflammatory medications. You have to, when an animal has mastitis, you have to milk them frequently as to remove that milk and to prevent it from getting worse, because it can get worse. You have clinical, you have acute. Yeah, it has different stages. It can get worse. So proper hygiene practices also prevent and manage the infection. So if you look at the image, you can see how this animal is huddled. You can see how it looks inflamed, like it looks red, it looks stiff. You see that it looks stiff, it looks inflamed. That's clear sign of mastitis right there. You can see the swollen feet, the swollen huddle. That's a clear sign of mastitis right there. Next on the list is the bovine papillomatosis. So both papilloma, they're like papilloma is also known as catarrhs, right? And it's a viral disease and it's caused by the bovine papilloma virus, right? It leads to the formation of benign tumors called papillomas or warts on the skin and mucous membranes. The virus is highly contagious. It spreads through direct contact or contaminated objects. So once you realize that you have an animal in the herd that is infected with papilloma, the best thing for you to do is to quarantine that animal, just isolate that animal from the rest of the animals, because papilloma is spread by contact. So if that animal goes and rub up against your barn or rub up against a tree, and then another animal that is not infected with it go and rub up on that tree or on that barn, then it will be spread by that way. And you can see in this image, like you can see how the tumors, you can see how terrible they look. They look very terrible, and you can see in the images, like they can be found on the reproductive organs of the animal. They can be on the teeth. They can be on the face here. They can be all over at any part of the body. Like these hideous looking things can just pop up on your animal, and it's not easy to get rid of. Even if you get rid of it, it can reoccur. So normally this is treated through surgical removal. They use topical treatments, supportive care, and vaccination. But a thing that I've done to treat this particular thing is autogenous vaccine. And an autogenous vaccine is a vaccine that you take some blood from the infected animal, and you re-inject it in the animal subcutaneously. So you inject it under the skin. So what this does, it helps the animal to gain passive immunity. So it will help the animal to fight off the papilloma. It will help the animal to fight off the papilloma. But in some cases, like the papilloma gets really bad and it's covering the entire animal, then in that case now you just call that animal, because they will turn to sore, and that animal will be in great pain, and you don't want to animal welfare. Like, you don't want to have your animal like undergoing constant pain. So you just call that animal just to get rid of the pain and just to relieve that animal of the pain. The next on the list is actually blackleg. So blackleg is caused by the bacterium Clostridium chavoi, which is commonly found in soil. Infections typically occur through wounds or ingestion of contaminated feed or water. Symptoms include sudden onset of fever, lameness, swelling, and depression. The treatment for blackleg involves administering antibiotics and anti-inflammatory medications to control the bacterial infection and alleviate symptoms. Vaccination against blackleg is also available and is an effective preventative measure. Now, this is a picture of an animal with black leg. Yeah, oh my god. I hate to see animals in pain. Like, I hate to see animals like just affected with these diseases and just going through the pain that comes along with these diseases and the difficulties and the discomfort. I hate to see it. Now, this is the end of the video, but I just want to leave this with you guys. It's essential for cattle farmers in Jamaica to work closely with veterinarians to prevent, diagnose, and treat these diseases effectively. Additionally, implementing biosecurity measures and vaccination programs can help reduce the risk of disease outbreaks in cattle herds. Now, this is the end of the video. Thank you for watching. I hope you guys enjoyed it, and you can just leave in the comment section like what video you want me to do. If I missed out anything in this video, if there's any disease that you'd want me to talk about, or there's any topic you want to learn more about, you can just leave it in the comment section and I'll do a video on it. Don't forget to like, share, subscribe. Thank you. Bye.